Who will do? Who want to do? Dr. Malik? Dr. Ahmed? You want to do?
Okay, Dr. Yes, it is please.
You will do?
Yes, Dr. Sadiq. Yes, yes, it is please. الو حضرتك سامعني؟
أيوة.
ايوه لو مفيش حد من الزملاء يحب يعملها احب اعملها.
Okay. Mr. Ahmed is 33 years old. He has been complaining of both lower limb swelling for the last 2 months. Please take focus history and examine as appropriate and reply any patient concern.
Okay.
Put good differential diagnosis before going to the exam on your paper and prepare yourself how you will ask about your differential diagnosis.
Okay.
So Dr. Rami, you told me before this is a case, our station 5 is a case of definitive diagnosis. Okay? So you have now lower limb swelling for differential diagnosis. You have many differential for lower limb swelling, so that you have to ask all your differential symptoms to pick up your diagnosis.
Okay, Dr. Khalid.
اوكي يا
Hello.
دكتور احمد.
انا صوتي واضح كده ولا اعدل المايك؟
اتفضل، يا ريت يعني يكون اوضح شويه. Make it more clear.
ايوه كده تمام؟
Yes.
Good morning.
Good morning, doctor.
I'm Dr. Ahmed and senior house officer in the military clinic today. I'm happy to meet you.
Nice to meet you, doctor.
Okay, can I confirm some data with you, please? You are Mr. Ahmed. You are 33 years old, and you have some problem with swelling in your leg. Is that right?
Yes, doctor.
May I discuss this with you, if you please?
Yes, doctor. I have both lower limb, both leg swelling for the last 3 months, doctor.
Okay, is it started? Is this lower limb swelling started gradually or suddenly?
Gradually, doctor.
Okay. Is it painful?
No.
It's present in both legs or on one leg?
Both legs, doctor.
What is the extent of this lower limb swelling? Up to below the knee, above the knee, or more than this?
I think involving whole my limb, doctor.
All the limb. I'm so sorry for this. It is involved the limb in both lower limbs, so its level is the same in both lower limbs?
Yes, both my lower limbs, doctor.
Okay. If you press over this swelling, it will leave a mark on it or no?
Yes, doctor, there is a mark.
Okay. There is any rash in your leg?
No, doctor.
Any joint pain?
No.
Any mass present in your groin or any area in your body?
Any mass?
Any mass, yes, present you can see.
You mean lumpus or bumpus? No lumpus or bumpus.
Yes. Okay. Do you have any shortness of breath?
No.
Okay. Anything you notice that it increase this lower limb swelling?
I'm not sure about that, doctor.
Did you try to take any medication or anything to relieve this lower limb swelling?
Yes, doctor. My GP gave me some water tablets, which helps to some extent.
Okay, but it did not resolve it completely. That's right.
What?
It did not resolve completely. That's right.
No, no.
Okay. Can I ask you another question, please? It will help us in our diagnosis.
Yes, doctor.
You have any heart problem? you are treating medication for?
No,
You have any awareness of your heartbeat?
no,
Any chest pain?
no.
Okay. You have ever have cough?
What?
Cough. Do you have cough?
No.
Okay. Any production of phlegm?
Any imbuction of what?
Phlegm.
Imbuction of leg?
Production of phlegm. There is any phlegm?
Phlegm? No, 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 doctor. Phlegm? No, at all.
Okay.
But you know, doctor, I have history of cough, yes, and my and sore throat 3 weeks back actually.
Okay. Did you take any medication for this?
Yes, my doctor gave me some antibiotic. My GP gave me some antibiotic, which helps.
How many days you have this cough, this sort chest infection and
Just for
upper
2 or 3 days, doctor, I had the fever or sore throat, and my GP told me that I have upper respiratory tract infection or something like that.
after, and it was related to this lower limb edema or lower limb edema it was before this. It is not related
No,
to
doctor,
lower limb.
actually, this cough was before my lower limb edema. You know, it is maybe 2 weeks before, 3 weeks before. I don't remember exactly.
Okay. And this is the edema started after you take this medication and you after you have this
Yes, doctor.
problem, right?
Yeah.
Okay. What about your water work, Mr. Ahmed?
It's okay, doctor.
No problem with it. Any blood coming with the urine?
No.
Did you notice any frothy urine?
Through the urine?
Yes.
I'm not sure about that.
Okay. Any change in the white of your eye color?
No.
Okay. Any buffness below your eye?
Yes, doctor, actually. Recently, for the last 2 months, I have this buffness, especially in the morning.
Okay. Did you seek any medical advice for this?
No.
Okay. Okay, Mr. Ahmed. You have any mass in your abdomen or any abdominal distension?
Yes, doctor, I have my tummy also is enlarged than before.
I'm so sorry about this. Did you notice that there is any obvious? Is it painful?
No.
Okay. Is it increasing or is this abdominal distension is increasing?
Increasing, doctor, yeah.
Okay. Did you notice any change in your weight?
Yes, doctor, my weight increased so much because this swelling of my tummy and my lower limb.
I'm so sorry about this, Mr. Ahmed. Mr. Ahmed, how does this reflect in your life? How does this affect your life?
I think so much, doctor. I'm working as engineer and I have sick leave for the last 1 month because I cannot work anymore like that.
I'm so sorry about it. Mr. Ahmed, you are taking any medication for any chronic disease, long-standing disease?
What?
You are taking any medication for any long-standing disease?
No, doctor, at all.
Okay. I will start to examine him while I'm taking the history for the time, okay? But I will examination later.
What examination will do, doctor?
I would like to first examine the lower limb to see the
Lower limb,
extent of.
okay. There is the lower limb edema and the deep bedding edema. Grade
I
3.
will see the extension, if it's extended, if there is any sector or no, or it's below the knee or over,
Is
over.
over the lower limb actually.
Okay. I will examine also take general examination. I will see any stigmata of liver disease or any infected stigmatic infected endocarditis. I will do general examination also with the face. If there is any changes in the faces like buffness below the eye, below the eyelid.
Okay, you will examine the abdomen.
I will examine also the chest, start with the heart and chest, and I will examine the abdomen for ascites and any organomegaly.
Yes, okay.
And I will examine also the flanks. I will do a lot of the kidney.
You will examine the CTS, cardiovascular system, for GVB.
Yes, this is part of general examination. There is the GBD.
Femur mars.
mention evilness,
For any
the heart,
members, okay, and the
the
bilateral
heart and the lung
bibasal, okay, lung
crackles,
fills, bilateral bibasal lung fills for crackles.
and the abdomen for ascites, organomegaly, hepatomegaly, or splenomegaly. I will examine also for renal masses, if there is any polycystic kidney presence.
Okay,
Do you have
1 minute remaining.
okay? What's your main concern, Mr. Ahmed?
Yes, I'm concerned what it could be, doctor, this lower limb swelling. I'm actually anxious about it.
I am appreciating your concern so much, but before this, I would like we have many differential diagnoses for this, and we would like to admit you to the hospital and be doing some investigation for you in the form of some blood investigation and some urine investigation and another imaging to decide what is the actual cause for this. And after the releasing of this test, I will do another meeting with you to tell you exactly what is the actual diagnosis and what is the management. Is it okay with you?
Okay, is it treatable, doctor?
This question we cannot answer now. We should first reach an accurate diagnosis by completion of your investigation, and after this, we can do we do the accurate diagnosis, and it's treatable or controllable. Is it okay?
Okay, doctor.
Any other concern I can answer for you?
No, doctor, thank you.
There is time or خلاص finished?
Okay, finished. So, examiners questions. So, what's your diagnosis, doctor?
I think there is differential diagnosis for this. My differential diagnosis may be nephrotic syndrome, maybe also
Okay, this case is a nephrotic syndrome, doctor. So, what investigation you will do for this patient to confirm this is a nephrotic syndrome?
Okay, I would do urine analysis for this to see urine analysis to see if there is proteinuria or no. After this, I would like to do
Proteinuria for urine analysis. You mean urine analysis for proteinuria?
to detect 24 hours urine collection for proteinuria.
Okay, we said before it is basic investigation and specific investigation.
Okay, basic investigation would be in the form of the whole blood count, urea, creatinine, electrolyte, liver function test, okay, and renal function test. I will do also inflammatory markers in form of ECR, C-reactive protein, and the autoimmune screen. Then I would like to do urine analysis, 24 hours of protein collection, urine for proteinuria. I would like also to do some imaging in the form of abdominal ultrasound. And the last is to meet, I think that's all.
How much proteinuria and 24-hour protein to decide this nephrotic?
More than 3 grams.
3 grams.
Yes.
Okay. Okay, what could be the cause of nephrotic syndrome in this patient, doctor?
Maybe it's post infectious, the autoimmune disease or post infectious post respiratory